Amanda Leach and I'm working at the Menzies School of Health Research. Working in ear and hearing health of Aboriginal and Torres Strait Islander children, particularly in remote areas. I was actually working in the laboratory. I'm a laboratory scientist in microbiology. I was asked by our director if I would be interested in doing this microbiology of ear disease. So I was given the task of setting up the lab for every pathogen that might cause ear disease. It goes back to the microbiology, I think, and of course there's the overarching issue of poverty-related circumstances, so crowding, exposure to smoke, poor hygiene, houses that don't support easy washing of kids. There's one bathroom for 10 people, and the fact that these people are now being forced to live in much bigger communities. They no longer have their nomadic traditional lifestyles, and all of that feeds down through those layers to being what is really a massive problem for Australia. So we have about 15% of children still with these discharging ears. 75% have either a glue ear or a bulging eardrum, which is an acutely affected eardrum, and only 10% of children for 20 years in all of those prevalence surveys, 10% or less have had normal ears. But what's important is that the WHO have a criteria of 4% for being a public health emergency. But we know whenever a child has any form of otitis media, they have this very high level of hearing loss. It's a disabling hearing loss. It's like putting your fingers over your ears and trying to hear the world, understand the world, communicate with your mum and your dad, and you don't want them to get cross with you because you didn't hear and you didn't understand, but of course children don't understand. And the hearing loss is not unlike what it might be for your grandma. So it's quite significant when you think of the learning, the brain development that's going on at that time. So it's a CRE, Centre of Research Excellence in Ear and Hearing Health of Aboriginal and Torres Strait Islander children. In Western Australia there are laboratory studies that have been looking at novel therapeutics for children that come into surgeries for chronic suppurative OM. Our CRE has also increased the confidence and capacity of researchers to apply for further grants. So there's now another clinical trial that's starting, so that will be for children that have this glue ear. What can be done for children with glue ear? Across the CRE we're working on an update of the guideline on recommendations for clinical care management of otitis media in Aboriginal and Torres Strait Islander children. Big long name, called the OM guideline. What we're doing now is reviewing all of the evidence that's been published since then and using now a global methodology for assembling that data and presenting it in a guideline and an OM app. So we'll have something that's in the pocket of every GP and nurse practitioner, Aboriginal health worker, that help them to diagnose otitis media, the glue ear, the bulging drum, the suppurative runny ear, and know the appropriate latest best evidence for how to manage that. I think certainly I would like to see eradication of perforated eardrums. That's number one. The other is this massive impact on education and social isolation. You just see those children with hearing loss, they're not engaged in the fun that their friends are having. And there's qualitative research has been done that just shows how cut off these people feel. So if we can do something more for those children, get in early, prevent the disease from starting. So we talk about primary, secondary, tertiary prevention and treatment. So we need strategies for preventing the disease, preventing it progressing, and we need strategies for preventing or restoring hearing loss through hearing aids and surgeries, and then also strategies for helping teachers to recognise that that child's misbehaving not because they're a naughty kid. They've probably got a hearing loss. They need to be at the front of the classroom, not the back of the classroom. That's my hope for ear disease.